Hi, I'm Dr. Lou Papa, primary care physician on Second Opinion with Joan London. Today on Primary Health, bone density screening. A bone density test is a way to measure the strength of your bones, and the main reason to have the test is to find and treat a serious bone loss called osteoporosis. Bone density tests are simple and effective tests to assess your bones for osteoporosis before a broken bone occurs. The most common test for bone density is a DEXA scan. This test uses a machine to measure your bone density, and it estimates the amount of bone in your hip, spine, and sometimes other bones in your body. The lower your bone density, the greater your risk for breaking a bone. So, who should have a bone density test? Most women age 65 or older should have a bone density scan. Women in this age group are at high risk for losing bone density, which can lead to fractures. But you also may be at risk even requiring a scan before age 65 if you have a very low body weight. If you have one or more fractures after the age of 50, you've lost a half an inch or more in height within a year. You're receiving medications or treatments that can reduce your bone density. You have a medical diagnosis associated with bone loss, or you have a family history of osteoporosis. Other risk factors include things like lack of physical activity, smoking cigarettes, heavy alcohol drinking, and not getting enough calcium and vitamin D in your diet. And keep in mind, sometimes these recommendations do apply to men, but very often it's case by case with men. So how often should you have your bone density measured depends on your age and the results of the previous DEXA scan. Most people need a prescription or a referral from their healthcare provider to have a bone density test. So talk to your doctor about your risks and if a bone density test is right for you. And remember, it's never too early to start thinking about bone health. So focus on building and keeping as much bone as you can through exercise, good nutrition, and staying healthy. I'm Dr. Lou Papa. From all of us here at Second Opinion with Joan London, be well.